It may differ slightly. It's always going to be a tad bit unique, but there are some common principles that really need to be applied to everybody. Obviously, the amount of weight loss, the amount of metabolic dysfunction is going to determine the level of aggression and titrating up doses and time to get to desired effect. But a couple things. Before we start, I think there needs to be some understanding that what we're messing with is something that is fundamentally going to change our body composition. It's something to be taken seriously. And so you're committing to doing this, monitoring your body, but also like you're going to learn some lessons. The food noise may be quieted for the first time in your head in since God knows when. There's some lessons to be learned there. You're going to start changing the pattern in which you eat and not eating for boredom and just kind of eating more to feed the body. The more you can learn during this period, the more you're going to take with it. And probably start planning for an off ramp. Now, the pharmaceutical companies that sell this, there's no current guidelines for an off ramp to GLP-1s. But I don't think that means that we can't try. Having that in the back of your mind as well when you start is pretty important. As far as the primary things that need to be in this protocol to do GLP-1s right. One, monitoring, all right? So DEXA scan, blood work at minimum. Two, what are we doing for our food, okay? We can't just go with the plan, we're gonna eat less, because that's what GLP-1s do. You're gonna eat less protein, you're gonna be prone to losing body tissue. Let's do the things to make sure that that's mainly fat. So understanding where you're at as far as your protein levels and having a plan to hit your protein goal while on a GLP-1. Oftentimes this will involve tracking at first to get it right, but then it gets a bit more intuitive. And once you set up the things in place to make it repeatable, that's great. I'd say number two, but not because it's second importance, but it's just because that's the way numbering systems work. It is exercise. Strength training is critical. We're very concerned about you losing your muscle mass when you start this. And so by getting enough protein and making sure that we're lifting heavy things a couple times a week in whatever way that you find enjoyable and will do again, yes, we have to do that. Almost as important is making sure that you're getting enough movement. And I'm just talking about enough base, low intensity cardio, walking, zone 2, whatever you want to call it. We need a lot of that every day. Those are the biggest pieces because the combination of the nutrition and the exercise are really what's going to select the tissue that we lose, the weight that we lose. Where does that come from? And that's how we stack the deck to make sure that it's mainly fat. If I could get one message out on GLP-1s and preventative healthcare, it's just to do it right. These are great tools. They are so easy to get right now. You can get them anywhere. You don't even really need to talk to anybody. So there's just a lot more room for error, okay? Just make sure somebody's watching, pay a few extra bucks and do it right if you're not gonna do it yourself, but you need to be monitored. You need to be making sure that you're aware of what the body composition is, your blood work, your off-ramp plan, and just have somebody to help execute this with. One more thing to potentially add to the protocol is the off-ramp plan. There is no designated off-ramp plan as of yet, but something that we've been using is a medicine called metformin. And this is a very old medicine. It's very popular in the longevity medicine space just because it's been shown to increase lifespan in yeast and mice and humans. We've been using it for diabetes for years. It's its own subject. But in people with metabolic health issues, it's pretty safe to start. It's pretty darn safe. And so it allows us to get more effect from a lower dose of GLP-1. And what we've noticed is if we're able to ramp up the metformin a little bit as somebody comes off, it will decrease their rebound appetite, right? And so these are one of the things that we're working with to try to implement these off-ramp plans. And it'll be changing and developing over the years, but it's something that people should be aware of is thinking about reducing that weight regain, that rebound appetite, the things that are going to drive the poor outcomes from the GLP-1s that we're trying to avoid.